Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster. I'm here with Suzy Shirley from Pathfinder, which is a new platform for working with the VA. So we're going to get into that. Good to have you with us.
Thank you. Good to be here.
Start by just introducing yourself. What's your role at Pathfinder?
Okay. So I'm Suzy Shirley, like you said. I'm with the VHA, so Veterans Health Administration Innovation Ecosystem. And my role is Director of Community Engagement. And what I do is facilitate a number of different partnerships with academia, industry, veteran service organizations, and other nonprofits geared toward accelerating innovation in VA and improving veteran care.
Nice. Well, I saw a presentation about Pathfinder yesterday. Very exciting to see that you've created a website and a task force, if you will, aimed at speeding up innovation, bringing it to the VA. At Startup Health, we work with nearly 500 companies, many of which would like to impact that population.
Yeah.
So tell me what Pathfinder is and how it helps speed up that innovation cycle.
Yeah, of course. And so it solves the exact problem you just outlined. There's whole entire communities that are working to solve healthcare challenges that could have a big impact on veterans' care, veterans' lives.
Yeah.
And it's historically, and I mean still current day because Pathfinder is new, but it's been tough to work with the VA. I mean, federal agencies, all alike, VA not excluded from that. It's hard for startups to know, and not just startups, but industry in general. It's hard to know who to call, who to talk to. If you talk with one VA medical center or one vendor relations person or one clinician, it's you kind of get different information and different answers from everyone.
There's probably also a timing challenge. I'm guessing things don't happen quickly.
Yes.
So if you're your runway is like 12 months or
right,
how long does it take from first conversation to having a deal with the VA? Do you have any advice for a startup on how to navigate that?
Yeah, so one of the reasons we built the Pathfinder is to provide a better, more transparent, more efficient customer service experience for those who do want to improve veteran care. And so part of that is the timeline. We understand that some of these early stage companies, they don't have a long runway. They're particularly vulnerable early on, in the development of their company and as they're strategically planning what direction they want to go. And so, with Pathfinder, from the time they do a submission to 2 or 3 weeks later, we have a response from a group of subject matter experts, depending on what their solution is, where we can give them some feedback. Are they on the right track? Do they need to do X, Y, or Z differently, or come back to us at a different time? Because really, what we want to do, it's not just about creating opportunities to work together, but it's about giving people the kind of feedback that they need to make plans with the limited amount of resources they have.
Yeah, that feedback sounds really critical.
Yeah.
Is that a key component of Pathfinder, that now there's a subject matter expert that gives, answers your email within a couple of weeks?
Yeah, it is. It's, the Pathfinder kind of meets a number of different needs. And one is, as someone who's submitting an idea for an innovative solution, maybe you're a person who came out of a hackathon and has a concept, that you want to further develop, or maybe you're a young company or a veteran service organization. So you go through Pathfinder, which is this concierge type approach to submitting your idea, and you're learning along the way. What does it take to sell to the government? What does it take to innovate with us, to co-design a pilot or collaborate on a solution or get feedback, clinician feedback or veteran feedback on your idea. And so you're learning as you go, but then when you submit your solution, it's on the back end, it's getting reviewed by, we have over 100 subject matter experts and growing. We're really working to grow that community. So they're reviewing your submission and giving feedback and giving you ideas on what's possible with the VA or what comes next.
Something that was mentioned in the Pathfinder presentation yesterday that intrigued me, and maybe you can flesh it out, is just the range of levels at which a startup might engage with the VA, from, like you said, a co-developed pilot that's maybe unpaid, to a 8-figure, 9-figure deal for the whole VA. So kind of talk to me about that range.
Yeah, I mean, there's a wide range of solutions that exist, and so you could have anything from an early stage idea, and maybe you just want to get some veteran feedback on it, or maybe you want to better understand what the problem is you're trying to solve.
Yes.
So you want to
huge.
understand what clinicians have to say about it, or what VA administrators or veterans have to say about it, and what they need. Maybe you're a little further along and you've got something that's almost ready for market, but maybe you've designed it with a business model that meets needs for a payer or a provider, but the VA is both a payer and a provider, so you might need to tweak your model a little bit in order to work with the VA.
Will you be more likely to succeed if you really understand kind of where you're at? So like say you're small, you come in, you want some big paid pilot, versus coming in and saying, well, if I ask for something smaller, like an initial test with VA physicians, that's my foot in the door. Does that help?
It does help. And, as you can imagine, as we've been designing Pathfinder over the last, many months up to a year, we've created different ways of trying to elicit information from the submitter, because the submitter doesn't always know exactly what they need if they don't understand exactly what's available with the VA.
Exactly.
But we started out with a multi-select that you could select all, and what we found was people were selecting all.
Okay.
So really refining the design process and the user experience of Pathfinder to really help the submitter hone in on exactly what they need. It does help us as reviewers to be more specific about what we can collaborate on or what our feedback is for next steps.
How many solutions get pitched to you through Pathfinder?
Well, since we launched in June, we've fielded over 400 already.
It's not a wild number.
It's not wild, no. And we get part of the reason we develop Pathfinder is because and when I say we, I mean the innovation ecosystem, but also people all over the VA. We're receiving all kinds of just kind of extraneous emails from
I have an
people
idea.
who,
Just an email.
I have an idea, or where do you think can the VA use this? And like we talked about before, there's subjective responses that you get. I mean, people are trying to be helpful, but not everyone will have the same.
So you needed
response.
a pathway.
Yeah.
Interesting. Do you get pitched when you're here?
Oh yeah.
Yeah.
I mean, my phone was just blowing up.
What would you love to get pitched?
I'm particularly excited about new business models and care models. I mean, there's all kinds of tech solutions out there that show great promise, but the VA is really unique, and if really the innovation happens in the ability for the company and the VA to work together to enable the VA to consume the technology.
Okay.
So when we think about technology solutions around remote patient monitoring, so much of the innovation isn't even in the tech.
Yeah.
It's in how do we build the care models that allow the VA to consume that technology.
Exactly. It might be the same scale, might be the same blood pressure cuff. But what do you do with that information?
Yeah.
That's really interesting. Any final words of wisdom to a startup who's thinking about addressing an issue with the VA?
Final words of wisdom. Well, I would say, I mean, it sounds cheesy, but check out the Pathfinder, because we tried to plug in a lot of good information and reach out to us. If you've got ideas and you've got, ways of creatively solving problems, we want to work with you.
It sounds like what I'm hearing you say is like we're more reachable than you realize.
Yes. It's not a black box anymore. Yeah.
That's awesome.
This Pathfinder submission might take 20 minutes or 30 minutes. I mean, it's an in-depth submission.
Okay, so are you better off submitting like a really fleshed out deck? What do you suggest? How developed?
I think really being able to clearly articulate. I messed up on articulating that word. Articulating the problem, the solution, and any evidence that you have behind it. You may be very early stage, and it's fine if you don't have the evidence, but if you do, we want to know about it.
Almost like a college application.
Yeah.
Yeah, that sounds good. Yeah. Well, Suzy, thank you for taking the time with me. It gives me some optimism that this has been developed. What an important population for us to help, and what an interesting model of care that exists at the VA, and a place where we can innovate and then borrow some of that into the rest of society.
Yeah.
We innovate in that capitated model, and that whole health sort of model for the VA.
Yeah.
I don't know. It really is a sort of model for the future in many ways. So it's awesome to see you guys develop.
Yeah. Thank you for having me. I really appreciate it.
Thanks, Suzy.
Yeah. Thanks. Bye.